housing is healthcare, we say, and there's not a single clinical intervention that our providers can provide that improves health as much as rooting that care in permanent housing.
Good. Well, I definitely want to talk a bit more about that, because I think there's some similarities in terms of how we're approaching our business too, with regard to our fight against food insecurity.
Right.
I thought maybe a good place to start, obviously, is just talking about the effects of COVID on our missions.
Oh,
right?
my goodness.
You think about the nonprofit space and the way different organizations have had to respond to this demand and the need in their communities. And I'm just trying to get a sense of, give our audience a little sense of what the impact was for your organization.
Yeah, 18 months ago, our access to services completely changed, and for both of our organizations. Homelessness was already a public health emergency. Right. People experiencing homelessness were already dying at 4 to 10 times the rates, depending if someone was living in shelter or on the streets, as those who were housed, of hypertension and diabetes, of increased rates of mental health and addiction challenges. So we knew that at the very start of all this, that we had to keep our doors open. Absolutely. But we also knew that something like COVID, for people living their private lives in very public spaces or living in crowded congregate facilities, could spread like wildfire. Right. And because of the presence of acute and chronic health problems, people would be more at risk of serious illness and death. So we knew we had to slow the spread. So 18 months now of figuring out things that, I'm sure your organization is like this as well, things that usually take months and years to implement, we were doing in hours and days, right? Screening, testing, vaccination, right? What is this? Completely overhauling our access to care, right? And so, I think it has had a tremendous, it's placed a tremendous strain on our staff. I worry about the structures within the organization, but it has also illuminated all of the structural realities that make our work absolutely necessary. Right.
Absolutely.
And can it propel us, I think, to start looking at things like access to healthcare, access to housing, access to food, not just as these market commodities, but as fundamental human rights. Right. If there's anything a global pandemic has taught us, I think it's very much that. How about the food bank? I mean, my goodness, suddenly I would imagine that it radically changed the way that you operate, because you don't want to inadvertently spread it to vulnerable populations either. What
I mean, literally to your point, so 18 months ago, literally overnight, we saw demand nearly double. And at the same time, we had the situation of a supply chain that basically just freezed up. Anybody who went to a grocery store last March or April knew exactly, you saw what those shelves look like, right? People are sheltering at home, people just rushing to stores to provide for their families, and suddenly a significant source of food for us as a donated resource was no longer available. And then also as a purchasing resource. So in other words, suppliers that were providing supermarkets are the same suppliers we reach out to buy in bulk for the support our mission as well. So that really affected our ability to reach people. So it was a dramatic shift for us, and both in terms of access to food, access to individuals, people who were hesitant to leave their homes, right, to go to sites to potentially source food. How to think about the different distribution delivery channels so that we can create low-touch environments, low-touch interactions. And this began to fly in the face of the direction we were going as an organization to create more of an intimate, personal relationship with folks on the ground, to understand some of their needs so that we can perhaps address not only their near-term need of providing food, but their long-term needs. But I want to hit on the organization too. I mean, the lessons learned coming out of COVID. What's that quote that says, "Never let a good pandemic go to waste," right?
Never let a good crisis
go to waste.
Right.
So
that's right.
I think there were some things that we learned about ourselves as an organization, things that we thought maybe we weren't prepared to do, or we couldn't do at a very rapid pace. We were forced to do. So it helped us make decisions faster, broke down some barriers that kind of internally over time, the organizations organically create these kind of structures that perhaps impede progress. And so this really helped us to break some of those things down and move very quickly into responding to the need. So, but the amount of food that we purchased, we spent $36 million in food during the pandemic. We normally would have spent $7 million. So the need, that was the only way we could provide food into the need. But as a go forward basis now, it really says to us, purchasing should be an important part of our model going forward, because we can control the content of the food.
I've read recently that food prices now, 18 months later, are going up.
Yeah.
And I would imagine for all of the same supply chain and workforce challenges that we're struggling with, I would imagine that that's affecting you right now as well.
Yeah, very much so. It's real. So continue to purchase at high levels, and the cost associated with food, just to give you an FYI, pre-COVID, we averaged about 45 cents a pound for the full mix of product that we would buy.
Right.
Today we're at 80 cents a pound.
Okay.
So think about buying 2.5 times the amount of food at 50% more, 50% higher price. You can get a sense of the pressure on the organization, the financial pressure on the organization to respond to that.
Right.
Some of that's inflationary. There's no doubt about it.
Sure.
Some of it's higher quality food.
Right.
We feel like as a food bank, coming back to some of the conversations that you and I have had around nutrition and providing healthy outcomes for people, getting them access to the healthiest, most nutritious food we possibly can, we know has long-term implications in terms of their abilities to thrive. Right.
Yeah. While we were trying to slow the spread of COVID among those that were on the streets or in shelters, our clients in housing faced a very different problem. Both of our areas of work, as you said, are fundamentally about relationship building, right? They're relational in nature. It's about having a genuine relationship, building trust. That requires in-person interaction, and suddenly we couldn't. Right. So we were reaching people by phone, and telehealth proved very important for us.
So even for your segment of the population, telehealth was still a viable channel.
Yeah. Everyone told us no, telehealth isn't gonna. People experiencing homelessness aren't going to be able to access telehealth, and with a screen, high-speed internet access. Right. You're not going to do like video telehealth necessarily with those experiencing homelessness, but phones are ubiquitous, and they're cheaper and cheaper, and people have access to them. Many of the free phone companies during the pandemic offered free minutes, and so there were no longer restrictions on them. So we found that we could actually reach our clients by phone and stay in contact with them. The challenge for clients in housing is that they couldn't safely get out to get food. And so, a partnership that we did with your organization, because of the fresh produce you were getting and then distributing, we could assemble food boxes on a regular basis, and we're still doing this right now, and deliver them directly to the doorsteps of our clients in housing, very, very safely. Then our providers would go back to the car, they'd phone, they'd make sure the person came out and picked up their box, and that was just a really effective collaboration.
That's another great example. Our organizations probably didn't work as much together prior to COVID. So to some extent, it forced us to kind of find a way to work together even more effectively. And so home delivery is something for us. We got to figure out, is a way to, we're built for scale. We're built for large distribution events, serving large communities. And I think to the extent that we can find ways in which we can reach fewer and fewer people in smaller and smaller areas across our state, pockets of areas where people who are suffering from food insecurity that may not have access to it. That's kind of our future model going forward. And so developing partnerships that may not normally come to mind as places we can do that, I think is one of the benefits of what's brought to COVID.
Yeah. Well, I think we've discussed this in the past. A global pandemic simply illuminates everything that existed previously. The weaknesses and deficiencies and structural inequities, as well as the great strengths. Right. So when I look at our work prior to a pandemic and really looking at the social determinants of health and asking our clients about what is serving as a barrier to their health, the three things that top the list are housing, transportation, and food. So of course, during a pandemic, it highlights that. And as you said, we've been doing some collaborations over the years, but it really highlights the need to do even more, as well as highlighting the structural inequities that necessitate our work to begin with. Right. Black and brown people, for example, are twice as likely to experience food insecurity. And during a pandemic, Black households three times, experience food insecurities at rates 3 times of the white population.
Absolutely.
Right? When you look at people experiencing homelessness in Maryland, those who identify as Black or African American represent about 29% of the population, but 57%, closer to 60, almost twice, percent of people experiencing homelessness in Maryland are Black or African American. And so we see that reality in our work.
Right.
We see that reality nationally with respect to homelessness. The populations that are most overrepresented are Native American and African American.
Okay, so it's not unique to Baltimore for sure.
No.
Yeah, I mean, to your point, I mean, that's the COVID has illuminated that. So what are some things you guys are doing with regard to trying to address some of these inequities?
All of these inequities existed before a global pandemic. They existed before the knee of law enforcement brought a national reawakening to the realities of racism. Right. And so it's caused our organization to very, very seriously step back into a moment of self-reflection. We've been doing this work for about 4 decades. Right. Can tell you right now, it's not getting better. The conditions that we're addressing, yeah, we're doing some good. We're helping to house some people, but rates of homelessness are only increasing. What is it about the status quo and our organizational and frankly, my personal involvement in the status quo that's not changing that picture? And I think it's particularly relevant for white leaders of nonprofit organizations serving primarily Black and brown people. But not exclusively so, right? It's really relevant to anyone who's more in a position of power and privilege in an organization. And why is it that the majority of our staff working at the entry level position levels in our organization are primarily African American, and that percentage goes down as you go up the position levels within the organization, into the executive team, into our service providers? And rather than kind of shrugging our shoulders, as I think we've done for a long time, yes, we're addressing inequitable systems and structures. How can we look more internal and say, what is our role? So we've engaged a group called the Center for Urban and Racial Equity, or CURE. We're working our way through an organizational assessment, a long-term racial equity plan. We've established committees of the board and the staff looking specifically at racial equity and inclusion. Recognizing that there is no quick and easy fix here, and it requires long-term sustained work in engaging the voices within our community to try to change the realities that we find ourselves in. And I would imagine you're involved in the same kinds of questions and challenges.
A lot of similarities internally to the organization's structure, right? In terms of dynamics around how we're represented at all levels within the organization. And so, I wouldn't say that necessarily historically we have had a blind eye to it, but have we put the energy and emphasis and focus on it? And I think for me personally, to your point, some of the training that we've embarked on, and we've started with ourselves. It starts at home is kind of how we're looking at it, saying how can we become better? How can we become better individually? How can we become better as managers? How can we become better as an organization that then in turn can have a positive influence on the communities that we serve? So if we're doing and acting and talking the right way, doing things that we should be doing, we think we have the ability to have an influence outside the 4 walls, but we got to take care of ourselves first. So it's a learning journey, to your point. We've engaged a firm, Sage Wellness, who's done a tremendous job and has had a series of conversations and workshops. And I think we're very much in the early stage. I think we got a lot of work to do, but it's opened our eyes to some of the challenges that we have, some of the challenges in our hiring practices, some of the challenges in our policies and procedures, some of the challenges in terms of job descriptions. And so I think there's real potential opportunity for us to do better.
Ultimately requires, an entire policy review, right? And a new kind of strategic planning. And we often ask ourselves early in this process to identify our blind spots. How can we find our blind spots when we don't see them, right? And particularly for those of us that have occupied positions of societal power and perpetuated racist structures
Right.
without realizing
Unintentionally,
it, right?
yes,
Yeah.
right. I mean, for me, it's been kind of an eye-opening journey, frankly, because I didn't realize what I didn't know. I didn't
Yeah.
realize some of the things I took for granted. And I think for me, it's allowing me to provide a much broader lens, a much more equity-based lens to the decisions we're making,
Mhm.
and to ensure that we're integrating that into our thought process every day.
Yeah.
As I read a quote with somebody, we want it to be a reflex and not an initiative.
Yeah.
Right. And so I think that's what we're trying to build towards. I mean, externally, I think the other thing that we have tried to focus on, frankly, is some of the conversation that we just talked about with regard to certain communities being more significantly affected than others. And so historically, we took a relatively broad view of the markets we serve. We're a statewide organization, and we would use statistics that would look at our food distribution, for instance, at a county level. And we would see statistics say, hey, we're doing a pretty good job in Frederick County. But what we didn't really have an appreciation for, and we're using data in a much more intentional way here to really understand where within Frederick, I mean, are we really doing a great job overall? I mean, are there certain communities that we can do a better job? Are there certain communities where the needs are even greater that perhaps instead of trying to create a kind of a homogeneous kind of an approach to this community, to Frederick County, for instance, as an example, do we need to do something different in certain pockets of Frederick City? So getting down to more of a zip code level, if you will, a very community-based focus, looking at data points beyond just traditional poverty levels, or we've incorporated some ALICE data from United Way, but we started to integrate things like unemployment claims, like housing, to begin to identify hotspots, right? So that as we now begin to think about our distribution strategies, where do we want to focus more of our attention? Because the needs are greater than we probably gave it credit for, because we're looking at things more as at a county level than a community level. And what is the right program to deliver in that community so we can reach as many people we can? And the third issue is, what's the appropriate food to distribute? Right. So they're all factors that I wouldn't say we didn't pay attention to before, but now we're really elevating the focus on that kind of work. And I think that's really going to have a big impact for us going forward.
Yeah, for us, on the housing front, just thinking about some of the lessons that we've learned, the importance of housing is just first and foremost. Right. And about a week and a half ago, we broke ground on a new collaboration where we're actually building 70 units of affordable housing, half of them, 35, for families and individuals exiting homelessness, half highly affordable at about 50% of area median income. Wow. And we're working with the Oliver Community Association. We'll be in the Oliver community to make that project happen. There's been something incredibly gratifying during a pandemic about working on something that we know is the ultimate solution, right? So how do we focus our efforts there more? On the clinical side, we've really learned, and you were referencing this as well, sometimes we erect barriers to our services that we don't really know exist. Right. And there's nothing like, the pandemic is forcing us to erect actual barriers, plexiglass. Yeah. Right. And taking a whole new level. There's nothing like really erecting barriers to make you realize, wait a minute, we need to tear down the things that we put up. Yeah. So we run a medication-assisted treatment program, for example, buprenorphine. It's a highly effective medical pill that can be administered in the medical setting. That's a treatment for heroin addiction. Okay. And yet, prior to the pandemic, we were requiring participation in groups a certain number of times a week. We were giving prescriptions for just small periods of time until someone came back and got another one. Right. So what are your penetration rates with those barriers? My goodness, but exactly. And then what we found out is suddenly we couldn't meet in groups anymore. Suddenly we had to give longer prescriptions because it was safer for somebody. Right. And guess what? Participation, retention, success in our medication-assisted treatment, or MAT programs, went way up. So how do we not reimpose those barriers as we hopefully come out of a global pandemic now, and continue to engage people? And this is where advocacy and focusing on work at the government levels, because some of these things are imposed at a certain, I mean, we're all the beneficiaries of grants. Yep. Right. And so there's certain things that we need to do to be able to produce reports and results and compliance orientation that makes some of the work we do that much more difficult. Yep. And so
So we've begun to, we made an investment in kind of stepping up our advocacy efforts. We've tended to, in the past, relied on other organizations who tend to be doing that in this space, and found that I think we can bring a lot more value as this on the ground provider that can bring some perspective. We can also ensure that, that our voice is heard, and that we're not really working off of someone else's agenda. But I think that's an important role for us to play, for sure.
Yeah.
In terms of advocating for programs that can feed people. I mean, SNAP is something that's been under a lot of scrutiny over the last couple of years, previous administration, and now, and people, talking about what it's going to look like long term. That's a significant program for us. And in terms of the amount of food it provides in communities, it's 9 times the amount. We distribute 70 million pounds of food a year.
Right.
That's 9 times what we would distribute. And then it has all sorts of other benefits to economic benefits to communities, and I think there's dignity associated with it. So, so these are programs that bad decisions can unwind 20 years of hard work in one signature of a pen. And so advocacy work is certainly an area that I think is a place we got to focus more attention on, and I'm sure you're thinking the same.
I mean, this is something that gets right at that question of status quo. What are the ways that we're just maintaining the status quo, or are we changing the structures that create poverty and homelessness and hunger, right? It's incredibly challenging. Are we about charity? And in many ways, our funders look at us as charitable organizations, or are we about justice and changing those structures? Healthcare for the Homeless was founded in 1985. 4 years later, 89, our first strategic planning process, we asked ourselves, are we a healthcare organization or an advocacy organization? And we spent a year arguing about it. And our answer was yes. We have to do both. We have to provide the best services that we can to vulnerable populations. We have to advance that mission to prevent and end homelessness. But we also have to change the public policies that create and recreate homelessness faster than we can stop it. And so that integration of services and advocacy, with each informing the other, with the voices of people with lived experience, the voices of our clients, helping to shape and inform that advocacy, the voices of the broader community, remains so very important. The risk is that, particularly through a racial equity lens, the risk is that we externalize that policy work. Yes, we're focusing on policy change, and we don't let it change our own behaviors in ways that maybe are upholding the same structures that we're working against in the external environment. That COVID breaks down that internal-external dichotomy with respect to organizations. We're talking about the same thing. Our staff are at risk of homelessness, right? And are struggling. So and hunger. So how do we address these things institutionally as well as in the broader community? But the integration of services and advocacy, absolutely essential. Critical. I see a lot of ways that our organizations can continue to collaborate on the policy side of this equation. Right?
Yeah, I think so too.
In Annapolis and Washington, locally.
Yeah, I mean, we certainly think Annapolis is a place where we're focusing most of our attention. But obviously at the national level, it could exist as well. I mean, I know you've done a number of hearings on the Hill over in your career advocating for that. So so you say it's interesting what you were saying about in that strategic planning process in 1989 or 90. That's
right, 1989. We do it every 3 to 5 years.
Advocacy or homelessness. And now that conversation has shifted a little bit to whether you are a healthcare organization or a homeless organization. Is that a fair assessment in terms of how that's evolved over the years?
No matter how many times we reaffirm it, every strategic planning process, I mean, there are lots of things that come up, but 2 questions always come up. Are we a healthcare organization or an advocacy organization? We always reaffirm it and say yes. Are we a healthcare organization or a housing organization? And we have always said, we're healthcare. Stay in your lane. There are plenty of other people that do housing. You don't have that knowledge and expertise. Well, wait a minute. We ultimately learned that there aren't a lot of people trying deliberately to make housing affordable to the lowest income families and individuals. But we also started providing intensive services in housing in 2001, in 2005, in 2007. We did strategic planning in 2018, and we looked we were serving more than 400 households in permanent housing. And we knew that those services were instrumental to keep people housed. How do you fund the housing?
Right.
How do you, when our nation is disinvested in housing, how do you fund the services? So in 2018, we asked those two questions again: advocacy or services, yes. Healthcare or housing. We all sat back and we said, housing is healthcare. And so one of our strategic goals over the past 4 years has been to develop sustainable business models, both for the housing production and for the housing services that we know are so effective. So we just about a month and a half ago hired our first real estate developer, a position at Healthcare for the Homeless, that's helping to advance our housing work. I just met with our housing committee this morning, looking at a multi-year plan for that. So it is, as I was mentioning earlier, housing is among the most effective tools that we have to meaningfully improve someone's health. I mean, think about it.
Yeah,
right?
Absolutely. I mean, it's pretty obvious.
The same thing is with food security, for example. If you don't have a place to keep and store healthy food, right?
Exactly.
So I mean, the overlap between our missions
is significant.
Very significant.
I mean, like, one contributes to the other in a major way. And it's, you know, I just think about some of the things you just talked about. I mean, as we've shifted our focus to continue to be a food distribution organization, we know that we got to move into spaces that allow us to focus more on root causes, and be in a position, because we have such an intimate relationship on the ground with a partner who's ingrained in their community, to have these broader conversations, to identify what needs might exist in that community versus another community. So the needs of Pocomoke are very different than the needs of Oakland. And so we need to understand those in a deep way, so that we can not only provide access to high quality, nutritious food, but at the same time, we can begin to invite other providers, to your point of staying in your lane. So this is where it gets, now you start getting this kind of gray area, right? But I think we I think are uniquely positioned to enter into this space because of the nature of the relationship and the symptom of food insecurity that's bringing people to our sites that allow us to have a conversation about the actual challenges they're facing that bring them to that site, right? And similar to what you're dealing with as well. I mean, these root causes are exactly what you just said earlier about food security being one of your root causes.
Yeah, absolutely.
So
you know, I think both of us coming up in our organizations have long been cautioned against mission drift, right?
Exactly.
And so it's something that I think narrows our thinking. And on the one hand, sometimes that's really important to do that, to make sure that you're focusing and you know, developing good metrics to make an impact.
Operating efficiencies, you're trying to use the best use of every donated dollar to make sure it's invested wisely. Yeah,
exactly. On the other hand, you know, in our case, how do you expand the boundaries of what we mean by healthcare, of what we mean by health, and how do you really get toward the underlying question of justice that drives what we do on the external level, and something that I know you and your staff have participated in. For the last year, we've been doing what we call a community of practice on homelessness, and it's looking at the range of issues that organizations address through a racial equity lens, and involving many different organizations, policy leaders, mayors, county executives, agency heads, in those conversations about inequities in healthcare, inequities in housing, inequities in food security matters. And that's one of the ways that we've developed and are continuing to try to, as you're doing as well, foster those conversations like we're having now.
Right. I mean, I think that's a critically important piece, because again, this is not stuff that we can do ourselves.
No.
Right. But I think what we do, both organizations provide is access to people who have significant needs, who then other providers can, you know, do their job and do their work. And so I think I'm really optimistic about our ability to do that. It is a one-to-one kind of a solution. It's a difficult to scale. But I think where we can, we should, you know, to the extent there are overarching root causes with financial security and workforce development, for instance, being an area for us to see if there's ways for which we're not going to enter the workforce development field beyond what we already do in our kitchen. We do have a culinary training program called FoodWorks that's been around for 10 years that have trained people to enter the culinary field. But our other opportunities,
I think that's exciting.
it's really exciting. I mean, and it's been a huge success in terms of the number of graduates we've had, the feedback we've gotten, Kevin, from the community about the quality of the students that we're putting out, the proactive nature that we're taking to solve some of their other challenges. So while we're putting the technical skills, we're addressing some of the other personal challenges they're having to put them in the best chance to succeed.
Yeah.
And to ensure that we're putting in places where we think there's a career path, where we think there's a compensation level, and there's factors like that that can lead to long-term success. So we're in the process of actually expanding our kitchen so we can double the amount of classes we have going through. It's a part of the workforce that Baltimore's a pretty foodie town before COVID, and I think there's an opportunity for that to come back. And I think that's a low barrier to entry kind of a job, and I think it's an opportunity for folks to be able to gain some skills and gain gainful employment. But it's not the only source.
We'll have to make sure that our clients and case managers are aware of that program.
Right, as a referral.
And exactly,
Yes.
try to get you some people.
Well, and again, because transportation is a challenge, right? So we're not an easy place to get to. By the way, we're doing this live from the Maryland Food Bank. So if you hear beeping in the background, this is a live warehouse.
I love being in an active warehouse right now.
But we're not an easy place to get to.
Right.
So we've begun to identify other locations. We just opened up one downtown at the UA House as a way to kind of make access a little bit easier than trying to get here.
So what keeps you up at night these days, 18 months in?
Yeah. Kevin, you alluded to it earlier, frankly. I mean, we have been through a lot as an organization over 18 months.
Yeah.
We've asked a lot of our staff to come in here day in and day out to do the work that's necessary to serve our communities. And so, I think there's a fatigue factor that gives me it's probably, if you would ask me, the thing that's probably at the top of the list right now is the fatigue factor of the organization. It's our ability to continue on the work that's still ahead of us, especially in light of the fact that COVID doesn't seem to release its grip, right? We started on a strategic planning refresh process back in March. My thought was that might be a tad premature, but it was going to put us in a position that as we exited COVID, that we can begin to focus our efforts on where we want to go, taking the learnings from COVID to make us a better organization. And we're just not ready to do that because the demand continues to be very high. We're dealing with this next level of variant. People are still dealing with challenges at home. Schools and children are affected by that. So to me, that's probably the biggest piece that I'm concerned about is terms of our ability to keep this pace, keep this energy, and maintain that level of innovation and agility, to use an overused word, that came out of COVID for the next body of work.
The needs are so great. The priorities are so numerous. We're not, as you said, out of the pandemic yet. We're still in the middle of a life-threatening global pandemic. And I mean, I find I can't ask people that overloaded to do even more, even though more is necessary, right? So it's this really precarious position at a time when demand for our services, both of us, are gonna go up, right? Eviction moratoria are expiring. There are going to be people with tremendous food needs, people experiencing homelessness, coming into a system that's overtaxed and overloaded. That keeps me up at night.
Yeah, absolutely. I'm right with you on that. So I think we can go on forever here. So and so I think I want to just pause for a moment. And I really should have made a comment that along the way, I'm hopeful that we were encouraging people to send questions into the chat. So I might take this opportunity maybe to pause for a moment, Kevin, and see if we have any questions from any of our visitors.
We sure do. Thanks, Carmen. One question that comes up as you're talking about the pandemic still being very much present. How are you approaching the next 6 to 12 months as you think about wanting to look ahead, address those root causes and barriers you spoke about, but how do you approach that? Still navigating this pandemic?
You first.
Oh, thanks a lot. Thanks a lot. Yeah.
I'll have my coffee.
Carefully. It's clearly the pandemic has not subsided. Demand continues to be high. There are things that we have done during COVID that I think will become things that we'll continue to build on going forward. So continue to execute against the things that worked for us, and hopefully using the lessons we've learned during the course of the pandemic to get better at that every day. So we're more efficient, it's less taxing, it's more effective. And then to begin to we've been talking about this, our street plan refresh and what does launch mean, right? And so there's some parts of our organization are better suited to begin to move faster in some of those areas, other parts aren't. And we have to work hard as an organization to ensure that we're ready for that next part of this next journey. So there'll be some initiatives that we'll move pretty quickly on, and some initiatives that we'll move a little slowly on, because of the fact that we're going to have to continue to deal with this pandemic.
Yeah, for us, I mean, a couple of things over the next 6 to 12 months. 99%, even higher than that, of all of the COVID-related deaths right now are among the unvaccinated. So we're continuing to build out our capacity to vaccinate those we serve, and we are implementing a vaccine requirement for employment at Healthcare for the Homeless. So by the 8th of October, staff are required to be vaccinated against both the seasonal flu, I got my shot this morning, and against COVID-19. In the healthcare setting, we absolutely need to make sure that we are not exposing each other and those we serve to greater harm. Continuing our work on the housing front at the intersection of housing and health is so very important, and continuing to build that out. And you mentioned the importance of strategy. We're now at the end of our 4-year strategic plan. And so we just put out, or about to put out, an RFP for a strategic plan consultant. And we're going to go into 2022 into a very intensive period of strategic planning, looking at the lessons learned from our racial equity and inclusion organizational assessment, looking at the past 18 months, looking at the past 36 years, looking at the current needs, and charting our strategic path forward. We're going to look at our mission, we're going to look at our values, we're going to look at our vision, and at what that strategy will be over the next 3 to 5 years.
So is that a typical exercise? You said you redo that regularly, but do you actually take that holistic view to the plan every 3 or 4 years? Or is it mostly kind of a revisit of the plan and make adjustments as you go?
Historically, we've often done the kind of slight tweaking. I would say since 2012. So 2012, 2018, and 2022. They have been, and they will be, more comprehensive assessments of where it is we're going. And how can we make sure that a strategic plan doesn't sit yellowing on a shelf? We think of it much more as strategy, and strategy is active. And what is our strategy? We evaluate it every year. We do a strategic plan, a strategic priority assessment for the past year. How we try to encourage our staff and the broader community, our clients, to hold us accountable. This is what we said we were going to do. Did we do it or did we not? Right. And so that kind of public accountability, I think, has been really important. How do we let strategy guide everything we do and not be separate from it?
That's exactly right. I mean, I think some of the challenges that many organizations face, is the fact that it becomes outside of the scope of your business as usual work. Right. Like it's a project, it's another project, and it's got to be what you do. And I think to the extent that it's very important to engage the whole staff in that exercise in a way that people can see the vision and provide the proper input to make sure that you're able to execute.
In the past, it always used to frustrate me. We'd get to a point in the year organizationally and people would say, what are we doing? Or a board member would ask, what are we doing on our strategic plan? And it was like, oh yeah, that thing that we have to get back to. Since 2012, no one has asked that question because it's literally driving
your plan is your work.
Everything we do.
Yeah, that's a great call. It's a great call.
Well, on that note, we do have a question from Dr. Noonan, who's one of Maryland Food Bank's board members. What is the role of community in strategic planning and governance?
You want to start that one?
Very, very good question. I mean, Kieran Havens, our chief strategy officer, taught me this about 10 years ago, that the community calls us into being. Right. So we would not exist as a nonprofit organization if the broader community hadn't worked to make that happen. Right. It's not anything. Our organizations existed long before us. Right. And so absolutely essential to define what is your community That can be a loaded question. And what are the ways that we're engaging a broad cross section of our community in the process? So we've long had elected seats on the strategic planning committee for our staff, for our clients. We've engaged community members that are not directly affiliated with the organization, but share some mutual interest to join us in that process. So some ways that we've done that. How about with the
I think this notion of gaining more client voice and a better sense of what the community needs are. Again, going back to the model we're trying to develop is a more community-based orientation. This is critical to our work because again, we need to understand the fact that there's certain, even within Baltimore City, as you know, is what very well. Some sections of Baltimore, the needs are very different than other sections of Baltimore, right? And so we need to have that on the ground experience. And so we historically done a very good job, I think, of seeking input and direction from our 350 partners across the state who are on the ground every day. So they're a great a source of feedback and direction. But what we're doing is taking that another level now in terms of making sure we are engaging with clients themselves in terms of the type of food we're providing, the way we're providing it, the experience that they have at their facility. And again, talking about broader needs they might have. That's critical to our work going forward, so that we're not sitting in Hillthorpe trying to decide what we think is the appropriate solution for communities, 100 miles away. So it's Dr. Noonan has been an advocate for that in our board for some time, and I think we have really begun to do more and more of that kind of work, and our chief strategy officer is kind of leading some of that initiative and gathering that data, and it's helping inform decisions in a way that perhaps we didn't do before, as well.
And it can help us sometimes, I think, get out of our own way. Right. Sometimes we get so wedded to.
There are some blind flashes of the obvious, right? In terms of what we hear, but I think it's important. In some cases, it reaffirms. In other cases, it does shed light.
Right.
Thank you. We have another question from Christian Wilson. We are creating housing in the Oliver community as well. Are your units for sale and or are they rentals? We believe that the best way to get people out of homelessness is to offer homes for sale through creative financing so that they can remove themselves from being homeless.
Yep. So in the case of the Sojourner Place at Oliver, a 70-unit development, it will all be rental housing. And so 35 units for families and individuals exiting homelessness. And we focus on very purposefully on the most vulnerable using a housing first model. So we're focusing on people that often have serious mental health or addiction challenges to keep them stably housed and then provide a very intensive array of services. And then also trying to make rental housing affordable to people at 50% of area median income. So those other 35 units are very, very important. I think home ownership is very important. We've had policies in the United States that have benefited those with the most resources. We take our homeowner interest tax deductions, and that's policy that needs to fundamentally change. But there's also a tremendous shortage of renter housing for people with extremely low incomes, and that's what we're trying to do with the Sojourner Place project. Certainly applaud the efforts of others that are working on home ownership in the same community.
And so the funding for these type of projects are state, federal, both?
So this particular project is largely funded through the low-income housing tax credit process. So we have a development partner, Episcopal Housing Corporation. We've done some work with them over the years. We collaborated together in 2019 to apply for a supportive housing set aside in the state's low-income housing tax credit program. So we competed for it, and it had to be largely serving populations experiencing or at risk of homelessness. So we were awarded that in 19, and then we've been working. So it's a $22 million project, largely through the sale of tax credits, some federal, state, and local soft debt on the project, a grant from the Harry and Jeanette Weinberg Foundation that helped make that possible. The interesting thing about this project is through the cash flow of the project, we won't have a permanent construction loan. So we'll get about $200,000 a year to help fund the services that will keep people stably housed.
Oh, wow.
So it's a way of testing that model.
Wow. It's bringing me back to my money banking days in terms of that's a pretty creative and complex.
It's often
program.
Financial institutions that
Buy
purchase the tax credits.
the tax credits.
Exactly. So maybe you can provide some
put
insight.
a call into my former colleagues.
We'll get you on. We'll get you on our housing.
I'm not
committee,
sure.
Carmen.
I got enough on my plate. Thank you, though. Appreciate it.
I may reach out to tap those
All right.
recesses of your brain.
Sure.
What other questions do we have?
All right. Joanne Heiligman is asking, what is the best tool we have at present for eviction prevention? It seems that the available funds from the government are not making it to the landlords/tenants. What is the local situation? How can a donor have an impact?
My goodness. That's an extremely good question. We have had for a very long time so-called eviction moratoriums during the pandemic.
Right.
There were still people that were evicted, but there were some tools that let people, essentially in Maryland, let people use the pandemic as an affirmative defense in court. So if you could prove that the pandemic was related to your reason for being evicted, that eviction could be held off. Well, all of those matters are going away now, and eviction prevention efforts are usually administered through a whole range of public and private sources, and they're always overloaded. And so people tend to go from place to place, getting a little bit of money from a church and a little bit of money from the Department of Social Services, and trying to stave off an eviction. It can be incredibly challenging. There are some pandemic-related resources that advocates are trying to get directed at eviction prevention. There's a lot of conversations and planning happening at the federal level right now in the Department of Housing and Urban Development. Secretary Marsha Fudge is very much in support of doing more to prevent eviction and increase access to housing vouchers and housing that is permanently affordable to very low-income communities. Congress is going to get in the way of a lot of those conversations.
I'm sure they will.
But at the same time, we've got, for the first time in my memory in this work, we have a housing secretary who says that we can end homelessness and that housing is the solution to it. That's pretty exciting.
Yep.
Secretary Marsha Fudge, also the first African-American woman to head the nation's housing agency. There's a lot of important work, I think, that'll be happening in the years ahead.
There you go.
Thank you. Along the lines of community voices and tapping into those resources and really coming at it from that perspective, what about representation on your boards in terms of having a community representative? What does that look like for your respective boards?
Yeah.
What does that look like for you?
It doesn't exist today for us with regard to community representation. And it's something that I think as we've gone through this equity journey, if you will, this is something that's come up and something I think we need to begin to address. As I said earlier, we are, I think more so than ever, reaching into the communities we serve and the clients we serve to try to gain more input and perspective. And so I think we are in a better place of doing that as an organization than we probably ever have to, but we haven't gone all the way to the point of our board makeup comprised of that voice. And I think, we have to think about how we can do that. We have set up various structures within the organization, again, these regional, I'm going to forget exactly what we call these councils, if you will, that we're engaging in these in conversations at the local levels to gather this kind of feedback. So it's happening at a committee-ish structure within the regional approach to the work, but not at our board level yet. And I think that's something worth considering. I think for us, one of the challenges I face with that is one voice is better than no voice, but is one voice enough, right? And so as a statewide organization, what's the right level of representation? How do we ensure that we're getting a good cross-section of feedback? And so it gets to a point where, what's the appropriate, if we take this step forward with regard to board representation, what would that makeup be? And how do we begin to determine who is and who isn't? And does it give us as broad a perspective as the work we're doing now in terms of on a regional basis, we're having these outreach.
Yeah. As a federally qualified health center and as a healthcare for the homeless project, we're required to ensure that those that we serve are meaningfully involved in the governance of the organization. Most FQHCs actually it's a requirement that 51% of their boards be made up of clients of the health center.
Okay.
Healthcare for the homeless programs can get a waiver to that requirement as long as we demonstrate that we're meaningfully engaging our clients. So, today, 6 members of our 25 person board have the lived experience of homelessness. 5 of them are clients of the organization, either in Baltimore City or Baltimore County. It's not enough just to have that on paper, but how are we meaningfully engaging and ensuring that those with lived experience have the resources that they need to meaningfully contribute. And so there's a client relations committee of the board that tries to get more voices involved. And then we've been over the past couple of years looking at ensuring that other community partners that we work with in the areas that we're serving are engaged at very high levels of the organization.
That's what inclusivity means, right? So
and the racial equity and inclusion set of questions has to start at the board because it trickles down to the rest of the organization.
I mean, I think, going what you were saying earlier about how companies evolve over time too, when I think about our board makeup. As an organization, again, this kind of movement towards truly ending hunger and addressing root causes and bringing more client voice is a bit of a shift for the organization. So historically, our board was built on skills around operating a highly efficient logistics distribution company. Right? Which we were very proud to be for 40 something years and still are today. But it wasn't necessarily geared towards how do we end hunger. That's a different question, right? And so and we are, as serious as we are about that, this is an area that we need to figure out how to tap into, because again, this is a little different skill set. It's a little different perspective. It's a little different source of feedback that we're going to need to incorporate in a bigger way.
Absolutely.
All right. Well, I want to say thank you to our participants. I hope you enjoyed this dialogue today. I certainly did. I learned a lot about Kevin and his mission. And hopefully the same for you, Kevin. I thank you for taking the time to join us here today and sharing your story. If anybody has any ideas or thoughts about other particular topics, community leaders, organizations you want to hear from, please let us know. We'd love to make sure that we are bringing folks to the table here who you all want to hear from. And I also want to thank you again, Kevin, for all you're doing, and thank you for the relationship that we have formed. And I look forward to finding ways to us continue to do more together.
Excellent, excellent. I'm still going to pick your brain on that, on your past credit, your past banking background.
I'll see if I can shake that loose, cobwebs loose.
It's been a pleasure. These are such important conversations that we need to keep having, and I look forward to tuning into other episodes of Coffee Talk.
Great. Well, you'll have a mug to have while you're doing
I will treasure it. Thank you.
Thank you all for joining us today. Have a great day.